Good evening, colleagues and friends. I am Professor Dr. S. Arulrhaj, Distinguished Professor, Dr. MGR Medical University, past National President, API, IMA, and Commonwealth Presidents. I am here to share some of my thought process about a common condition, obesity in childhood. We all know about the pot belly, all obesities in adults. Now the concern starts from the childhood itself, about 2 years. Now there are so many evidences that the obesity, if you want to fight, you should fight it in utero. What the food the mother takes is very, very important. There itself we must start the process. Now as per science, after 2 years we estimate the weight of the child. When it is overweight, that is about 4 times which is more than the standard WHO, and it calls as obesity when it is 3 times. When it is 4 times, we call it as a morbid obesity. Why we are concerned about this incidence is going up. We even label it as a childhood obesity epidemic. Nearly 39.9% of the children are obese, or we say it's about 40% obese. Why this much obesity comes? Mostly from the food aspects or the environmental factors. The food they choose, they always keep on chewing some junk food in the form of pizza, burgers, fries, all these things, which is being encouraged by the family also. India is a country wherein food is considered as a reward. Therefore, an excess food with a lot of calories is the major cause. Secondly, they don't do a physical activity. They keep on spending time on reading the books, or they spend more time on the screens, either in the television or in the mobile. These 2 factors are only responsible. Sometimes there may be familial or genetic syndrome like a Turner syndrome or Cushing syndrome or hypothyroidism and hypoparathyroidism. All those things can be there, but primarily an excess calorie than what is being spent and physical inactivity are the 2 causes. Why we are worried about it? 2 major things. One, many of the non-communicable diseases have their footings here, like diabetes mellitus, not only T2DM, T1DM also, even up to a beta cell failure has been discussed here, and hypertension, young hypertension, and dyslipidemia, and then cardiomyopathy. There is an entity called as obesity cardiomyopathy. All these things are very common. The second major thing is it is transferable to adulthood. Nearly 75% of obese children become obese adults. They then lead to a lot of non-communicable diseases like diabetes, hypertension, obesity, and cardiovascular diseases. We find myocardial infarction. I have treated a myocardial infarction at the age of 19. To that extent, incidences are becoming more common, and this obesity-induced cardiomyopathy can cause a early cardiac failure and can lead to a vascular component and an endothelium being affected. We can have a stroke or a myocardial infarction. All these things are happening. Now, how to control it? First and foremost is a childhood education, and the parents also should follow that. A maternal obesity is a major risk factor because children follow them, and mother during pregnancy is obese and the child also gets into it. Therefore, the parental obesity has to be prevented. Education has to be given to children, and they must be made to physically active. I used to tell my school teachers that instead of having an assembly in the morning, close to school about 30 minutes earlier in the evening, and along with the students, all the teachers go for a walk. That is good for the children as well as for the teachers, because teachers at the age of 40, 50 also get into a lot of medical problems. Therefore, the concept of diet and physical activity has to be put into the minds of the minds and brains of the children at school itself. Secondly, there are certain drugs available. You can always use that, and metformin is a good drug which is a fairly harmless drug, and sometimes you may have to do a physical activity, and the physical activity has to be streamlined. Like that, food also has to be streamlined. There are three segments of foods. One is green lights. They can take any amount, greens, vegetable, pulses. And then there is a yellow line. They take it, in limited amounts, carbohydrates. Third is the red line. They take it very, very less, something like non-vegetarian diet. And that way, these two factors have to be. Sometimes we may have to resort to some surgical therapy. Now, a lot of surgical therapies are available to reduce obesity. Recently, without an operative procedure, and endoscopic sleeve gastrectomy has been done. Many of the celebrities in the country and outside the country have undergone this process, and they are going well. And beyond everything, it is to be definitely made as a national process that people in the country eat less, rather, as WHO says, eat healthy and move for your health. Then we will always have a healthy community leading to a healthy India. Thank you, ladies and gentlemen.